So today we are talking about asthma. Asthma is a disease that can begin at any age. It doesn't matter if you are young or an old age, but in the process it begins, it tells us a lot about it. Asthma can be categorized as intrinsic and extrinsic. And if it is intrinsic, then it is not related to environmental factors or antigen or allergy, none of those things. That's why it can begin in the adult phase of life. Now, the extrinsic phase is always related to environmental factors, allergy to pollen, uh, or any antigen it includes in this process, and the extrinsic factors always begins at a very young age. Now the general characteristics of asthma are inflammation, hyper responsiveness, and reversible airway obstruction. If you see a asthma patient, you will quickly notice shortness of breath, wheezing, chest tightness, and cough. Now, wheezing is the most common symptom of an asthma patient, but all wheezing are not regarding to asthma. Wheezing can accompany in COPD, in cardiac myopathies, or even in lung cancers or a foreign body uh, uh, entry. Now, the diagnosis of asthma are pulmonary function test. Pulmonary function test measures our forced expiratory volume and forced vital capacity. In if you have asthma, your forced expiratory volume will be decreased, and your forced expiratory volume and forced vital capacity ratio is less than 70%. Now the second is the spirometry. After giving inhalation of a beta agonist, either you can give them oral or inhalation, the functional capacity, forced expiratory volume usually increase up to 12%, but it is only up to short times until the effects of beta 2 agonist wears off. Now the third is the chest X-ray. Chest X-ray, we usually do not do this for asthma. We do this to rule out other things aside from asthma. For example, pneumothorax, pneumomediastinum, or there is an foreign body. This usually gets ruled out by using the chest X-ray. Now your ABG testing. ABG testing we only do if there is a sudden decrease in PaCO2. Normally, if you have an asthma attack, you're hypoxemic and you're hypocarbic. The usual is you don't have enough PO2 and enough PaCO2. But if there is a increase in PaCO2, that means the respiratory muscles and all other mechanisms that can help you compensate that asthma attacks are not working. So so that we will do this to find if there is a respiratory failure. Now, if you have asthma, you confirmed it, you have find all the clinical features. Now we will come to its treatment. Now its treatment is usually includes short acting beta agonist. These are albuterol. Now the short acting beta agonist is our rescue drugs. This can be effect for 4 to 6 minutes. These are used for the sudden onset of asthma. These help in bronchoconstriction and helps to reverse the obstruction. Now for the long term use, we use long acting beta agonist. These are salmeterol for nighttime asthma and exercise induced asthma. For chronic, if you have a patient with chronic asthma and you have to give them the drugs or medicine for weeks or days, you can give them inhaled corticosteroids or oral corticosteroids for chronic. Now if you have a chronic patient, then you will suddenly also have respiratory failure that I told you about. For that you can give them to correct the oxygen saturation. You can also give them antibiotics for infection. As you can see, if they are extrinsic, for they have an infection, or they are intrinsic, you can give them antibiotics for infection, for mast cell or eosinophilia IgE. So this is the all about asthma quick review. Thank you.